As a parent, caregiver, or educator, it's important to be aware of the risk factors for suicide. Suicide is a serious issue that affects millions of people every year, and recognizing the signs of potential suicidal thoughts is crucial. In this video, we will discuss 5 common factors that could indicate that a child is at a higher risk of suicide. The first risk factor is a family history of suicide. If a child has a family member who has died by suicide, they may be more vulnerable to suicidal thoughts. It's important to watch for any changes in behavior or mood if you or someone you know has a family history of suicide. The second risk factor is mental health disorders. Conditions such as depression, bipolar disorder, anxiety, and post-traumatic stress disorder, PTSD, can increase the risk of suicide. If a child you know is struggling with a mental health disorder, it's advised to seek help and support from mental health professionals. The third risk factor is substance abuse. Children who abuse drugs or alcohol are likelier to attempt suicide than those who do not. If a child you know struggles with substance abuse, it's important to seek help and support. The fourth risk factor is access to lethal means such as firearms or pills. Access to these items can make it easier for a child to attempt suicide. If you know a child who has access to these items and is showing signs of potential suicidal thoughts, it's imperative to intervene and remove access to these means. And the fifth and final risk factor is social isolation. Children who are socially isolated or feel disconnected from others are at a higher risk of suicide than those with strong social connections. It's important to check in with children who may feel isolated or disconnected, especially during stress or crisis. Remember, if you notice any of these risk factors in a child, it's important to seek help immediately. As a parent, caregiver, or educator, it's essential to educate yourself and others about the risk factors for suicide. Please share this video with someone who might benefit from this information and subscribe to our channel for more videos on mental health.